We had a guy who wrote us a letter saying, get rid of the administration offices in the building, put in more beds. But can you get a sense to the public as to what is being done, what can be done, and why beds can or cannot be added?
Okay, so I can certainly see why people's perceptions are is adding more beds, just add beds, that's a solution. This is not something that's unique to Kamloops, nor unique to BC. This is across the country. So I think when you look at it in terms of capacity and how are we utilizing our acute care services, it's a multifaceted approach that needs to be taken. And I think in terms of strategies, we have worked closely with residential care and community care. That's not unique to interior health either. So there's numerous strategies going on in terms of how can we make it better for the patient and their journey through healthcare system in total. And I think from my perspective, we really need to do a lot of work up front in terms of what we can do with that to make the system more sustainable. So what I say in terms of perceptions for adding new beds, we have to do that. I'm not sure that's really the answer.
So what is the answer? You said there's other strategies, but can you be more specific?
I think the answer is really looking at how we're providing our care. So we have done some things, and I can speak for Kamloops. I can't speak for the rest of BC. So we have done things in terms of how can we get our patients home more quickly, make sure that they're safe and that they're not at risk. So some of the things are we've increased hours for the physiotherapists on the weekend so that they can go into the home and do the assessment for those patients that are being discharged. There's other initiatives in terms of the quick response program. They've added entire evening shifts for that so that we can set up services much more quickly and have somebody seeing the patient in the home. Or perhaps instead of actually coming through to the emergency department, we can get the services up front without having to do that. So I think it's taken a long time for healthcare to get into this situation, and there are no easy answers that are going to be a magical bullet. So I think it's getting all the right people together and focusing on what we need to do for the sustainability of healthcare as well, and still providing what our patients need.
So the one criticism I hear is, why are they got the offices in there? Why aren't they adding beds? But I mean, I think that's when people look and see how many beds we used to have and where we're at now, and yet the city has grown, they have difficulty understanding that.
People always talk about 400 beds here or whatever, but over the years technology has changed as well. So I can give you examples in terms of, say, some of the orthopedic injuries that used to happen. You would be in traction for weeks and weeks and weeks. So now with some of the surgical procedures that they do in orthopedics, people aren't in the hospital for weeks. They do the fixation and they're out. So there's lots of things. There's laparoscopic surgery, all sorts of things that have happened with technology over the years that made sense to say, okay, we don't need 440 beds or whatever it was, because we don't keep people in as long. They don't need to be here. We're not doing the same procedures. Things have changed.